Good morning, everyone. Hi, Stephanie, can you hear me?
Yes, I hear you. There is an echo. Who do we have on the phone?
How about now, Stephanie?
I'm hearing an echo. There are two people on the phone who have open mics. Perhaps they need to mute.
Stephanie, how about now?
That's good.
Okay, perfect. Thank you. That's much better. Okay, we're just getting things together. I'm going to ask if you're on for the public, if everyone can please mute their lines.
Can I just get your name too? Because your name is not on the screen.
For me, that's speaking.
Yeah.
I'm Danae Presley.
Okay. I got it.
Thank you so much. Thank you, Lisa. You're the courier
You're
reporter,
welcome.
okay?
Yeah.
Thank you. Everything's okay, Stephanie?
I believe so. Okay. Let's see. I'm just looking to see how we are doing quorum-wise.
Yes. I did get the responses. Now I'm just waiting to see if anyone's waiting and I don't see anyone waiting, so just waiting. We still have about 5 minutes.
Yeah.
Okay.
Do we have Carol or Mickey on the phone?
I think both of them are from the public.
Okay. All right. Thank you.
You're welcome.
Hello?
No.
Yeah,
Yeah, this is
okay.
this is Vicky Gross. I'm on the call.
Okay, that's 8028, Mickey.
Hi.
Your number is ending 8028.
This person sends an email out yesterday that we have to we have to know by 5 o'clock. Who the hell is
Yes.
that person?
That was the DAG's office. That was Jacqueline from the DAG's office.
Yeah, well, tell them to be a little nicer when they send an email out. I'm a volunteer. I don't work for them, nor do I get paid by them.
Can we talk offline, Nikki? Unfortunately, we have a lot of people on, and I can definitely discuss that with you later, if you don't mind.
But nothing to be said. I said what I had to say.
Okay, I appreciate it. Thank you. Good afternoon, Paul.
Hi.
How are you?
Okay, I just had a COVID booster shot and I'm reacting to it a little bit, so.
Oh, we better speed this up. We need you, Paul.
Yeah, well, I'm not tip-top. Listen, I do have a problem before the meeting starts. I sent a letter on the 18th, on the 30th of October to Miss Raganelli at the request of Miss Raganelli after she presented the draft communicable disease thing on August 18th. They asked me to write a letter with all the things that she agreed to and said, please put it in writing. I did. Now, what they sent us the last day or two was all the responses and comments and stuff. I wasn't listed in there because those were the comments from before. But I haven't got a copy of the updated proposal for adoption, so I don't know if my stuff has been put in there or not.
That was sent in the email, Paul. I sent that to all the council members in the email.
Say again?
I sent that to all of the council members in an email. That was sent to all the council members.
Well, yeah, but not the council members. Ms. Raganelli was supposed to put it into the draft to get it updated. They agreed to this in the August 18th meeting.
Okay, can't confirm for that. I can try to see if I can find out offline, because that has been sent. It has been finalized.
Well, when this person comes on that's supposed to present today, I want to know if my stuff is in there because they agreed to it in formal terms. It should have been in the minutes. And by the way, I don't have any minutes either.
The minutes, everything was sent. You mean from we didn't have an October meeting. The October and November meetings were canceled.
Yeah, I know.
Mm-hmm.
The August 18th minutes, did they ever get sent out?
Yes, they did. Yes.
Oh, I don't have them.
I can resend those to you. That's not a problem. But unfortunately, I have to get the meeting going.
Yeah, I know.
I can try to get that information for you offline.
Well, I'm more concerned about, number one, I'm concerned about the minutes reflecting my discussions with Ms. Raganelli and the agreements that they made. And number two, I want to see a copy of the thing without having to print out 200 more pages showing that these things were put in. If I have to, I'll read this thing in the minutes today.
Not 200 pages, you're not, Paulie.
It's one page. My letter to them.
Are we on the record?
No, we have not started. We still need one. We're still waiting for one more council member to have a quorum.
Oh, okay, Mr. Ronan, this is Genevieve Raganelli. I just joined. Were you asking about the letter you submitted?
Yes, ma'am.
Yes, we are treating that outside of this proposal because we can't do your changes on adoption, but we're going to refer that
It's
for.
terrible.
I'm sorry, somebody was talking over you.
Letters not being delivered, and one guy that said he got.
Can everyone please mute your lines? Number 669, please.
This is unofficial stuff. You might want to dial in because.
Nikki, can you please mute your line? And I didn't know.
Mr. Roman, can you
Here.
hear me? Oh, this is Genevieve. You know me, right? Sir?
Yeah, I see you.
Yeah, we have your letter, but we didn't treat that as a notice on the proposal. That was with regard to the, was that with regard to the, precautions?
These were the items that I discussed with you on the August 18th meeting of this Public Health Council. You agreed to these changes and said they would be made. You asked me to put it in writing. I did. Nothing's happened.
Actually, Mr. Roman, I don't know if you're recalling correctly, but some of them you were referring to changes that you had misread as deletions. You thought that
I didn't misread anything, ma'am.
Right. You said that we had called the name of the agency incorrectly, the local health officers or the local health agency, and you were looking at text that we were proposing for deletion. And you had agreed on the record, you made a mistake, that you were looking at text that we had proposed for deletion and that it was not correct. But you reiterated those in your letter.
I put 5 items in the letter that you agreed to make changes to.
Okay.
I would not have had the authority to make those changes, sir, so I'm sure I didn't.
Well, somebody needs to make.
Mr. Roman?
I'm sorry. I'm gonna shut up and let the run the meeting.
Mr. Roman, can we arrange a phone call afterwards and resolve any outstanding concerns? There's a number of members of the public here, and I think they would like to have us, proceed with the.
No, you get going, but I'm just telling you that I'm going to read this right in the meeting because it's not something offline. It's something that was discussed in the meeting, should have been in the minutes.
Okay. All right, so we're going to get the meeting started because we have a number of people. We do have all the council members here. Thank you all for joining us today. Good afternoon. My name is Danae Presley, and we're going to call the meeting to order. This is a formal meeting of the Public Health Council. Adequate notice of this meeting has been published in accordance with the provisions of Chapter 231, Public Law 1975C-10:4.10 of the State of New Jersey, entitled Open Public Meetings Act. Notice was sent to the Secretary of State, who posted the notice in a public place. Notice was also provided electronically on the department's website, and meeting dates has been published on 2 of the New Jersey papers. I will now call the roll. Ms. Stephanie Carey?
Here.
Mr. Paul Roman?
Yes.
Mr.
Sorry,
Mike?
you guys have the meeting going on the phone, but nobody has let folks in on the Microsoft Teams. I'm listening in, but I'm sitting here waiting off camera. Can you let us in, please?
Sorry, can you, we're actually doing a roll call. I will let people in, okay? Just give me a minute.
Thank you.
Sorry, Mr. Michael Rose? Mickey?
Can you hear me? Mickey Gross, I'm here.
Okay, thank you. And
Merry
Dr.
Christmas, everyone.
And Dr. Sophia Webb?
I'm here.
Okay. Thank you. Okay, we have 4 members of the council present, which does constitute a quorum. For the transcription purposes, please announce your full name each time before speaking. Please mute your microphones during the call. Greatly appreciated. And I will now let the other members in. You may proceed, Chair.
Thank you. I want to welcome everybody who is attending today and for your ability to be here for this specially scheduled meeting. We are in a major change for the field of public health in this point in time. We have a new governor with new focus areas.
Is this part of the meeting? Has the meeting started? I'm a new person to the forum, and it's very confusing. I'm in the waiting room, but it seems like you guys are continuing without letting me in virtually, and I keep asking for that, but y'all are continuing with the agenda. Can I be let in the meeting on Teams, please? Because you're announcing people and doing roll call. I don't even know who matches that name.
Pardon me, who is this?
Yeah, I'm gonna. What number is that? I'm letting them in now, but I would definitely let you in. We have to proceed with the meeting. I'm doing that now. What number are you calling from? What's the last four digits of your number? Is that 1281?
1281, yeah.
Okay, I'm going to have to mute you because you can't keep interrupting the meeting, but I will let others in.
That's fine. I'm confused about whether the meeting has started. If it started, I'm not sure why you are not letting me in.
Yes, I'm in the same position.
Let us in then.
We will let them in. Please mute your mic, okay? And we will let them in now.
May I proceed with opening comments?
Yes, please proceed.
You. Okay. All right. I want to welcome everybody who's taken time out of their day to be here today. We are in a period of rapid change. There's a new governor coming on board, a new administration. Federal guidance is in flux. And indeed, the change is so rapid that it feels like many long-standing accepted public health practices and sciences are being left behind in a whirlwind of activity. And at this point in time, it's more important than ever to amplify the voice of public health and to partner with people who value public health with the objective of protecting the health of the people of New Jersey and saving lives, because that's what we're here for. So that ends my opening statement, and I will ask for the next agenda item, which is approval of the previous meeting's minutes of September 8th, 2025. Do I have a motion for approval of the minutes?
Which meeting minutes are we looking at, or supposed to be
September 8th.
September. I don't have them.
They were sent in the email, Paul.
Yes, the December 17th email.
I'm part of the public. I hate to interrupt, but we're still not being let in through the online.
I'm not sure. I'm going to interrupt you for 1 second, Stephanie. I'm not sure what you mean the lobby has been cleared. So if you're calling in, I'm not sure what you mean you're not a part of the meeting, because we hear you and you're interrupting the meeting.
I think the meeting link on the agenda
talking about online
is leading to the wrong place. So maybe we need to post the correct meeting link, so that way folks can actually get into this meeting.
Okay,
that would be fair to the public.
I'm sorry, Dr. Sahu, you're really low. I couldn't hear you.
I think the meeting link that went out on the agenda is not leading to this meeting. it's leading to somewhere else, and that's what folks are stuck in.
Okay. Let me see. One second. Okay.
You've been muted. To unmute yourself, press *6.
So you're saying the meeting, the information was in the agenda is incorrect probably because I'm in this room then?
No, the hyperlink, the join meeting now hyperlink on the agenda, I think points to the October meeting, not to this meeting. So we should probably repost, if we can do that on the site, or repost the link to this meeting,
Okay.
so that way folks can actually join this one. The meeting ID and the dial-in number are all correct, but the actual hyperlink for join meeting now, I think, points to a different meeting.
Okay, let me see if I can put that in really quick. Okay, I'm going to drop it in the chat and let me know.
The folks on the phone probably won't be able to access the chat though, so we may need to post the new hyperlink on the website so folks can actually go in and
Okay.
click that. And I think at the same time,
Do that. That would be
Yeah.
great.
yeah, Dr. Tam's going to go in and post the updated link. I'm just not sure anybody can see it because they can't get into the other meeting either, but she's going to post it in the other meeting as well. But we should still post it on our website, the updated meeting link, so
Okay.
folks can access it.
I will do that now. Stephanie, do you want to do the roll call? And then I'll just get that on just so we can keep this going. Does someone want to accept the meeting minutes?
Yes, I will call for a motion to approve the previous meeting minutes from September 8th, 2025.
Sophia Webb, I make a motion to approve those minutes.
Dr. Webb, thank you. And do I have a second for that? Mr. Gross, perhaps?
Will someone second the minutes?
Point of order, I believe the chair can second but not make the initial motion. Is that?
Yes, that's
Yes.
fine.
So I will second the motion. And may I have a roll call, please?
Ms. Stephanie Carey?
Yes.
Mr. Paul Roman?
Abstain.
Michael Gross? Nikki Gross? Dr. Sophia Webb?
Yes.
Okay. We have 3.
Okay.
Motion fails at this point. I can't get Nikki.
Okay.
See.
So noted. We can put that on the January agenda.
Okay, and I'm posting this now for everyone to get to.
Madam Chair,
Yes, yes, Mr. Roman.
I'm asking that the minutes from the August 18th meeting and the September 8th meeting please be sent out to us, at least to me. I do not have them. I never received them.
So noted.
Okay, Stephanie, do you want to proceed with the chairperson's report?
Yes, I will make a couple of brief comments. Looking at the old business and today's agenda, there are important things going on. The transition of administration, developing budget recommendations, addressing public health staffing infrastructure, collaborations across multiple states. But the most important thing we need to work on today is the readoption of the communicable disease standards, NJDOH 8:57. So understanding if we speak briefly today on some of these other items, so that we can focus on 857. Understand that these items are not being given short shrift or being tabled, but that we need to focus on the communicable disease rules today. That said, I would be prepared to go on to some of the old business. If there are, and then with comments from the board later on the agenda. Under old business, New Jersey is part of the Northeast Public Health Collaborative, a multi-state effort to assure sound public health policy at state levels. Dr. Sahu, I didn't know if you wanted to provide additional comments on that at this point, or whether you would like to table that at this point in time.
Thanks, Stephanie. Yeah, I can make a brief comment that we're partnering with other Northeast states in coming up with things like clinical guidance and documents that we can align with. And I think really the goal is that so there isn't dramatic variation when, a person goes from New York to New Jersey to Rhode Island and things like that. And so I'll just leave those comments brief, but I think it's a pretty fruitful collaboration between the Northeast states right now.
Thank you, and more important than ever. We also shared a one-pager for the transition team on the role of the Public Health Council, in particular, its role as an advisor to the commissioner, to amplify the voice of public health, to encourage and support sound policy decisions, and to serve as a conduit of community feedback, community temperature, let us say, to serve as a conduit for that kind of input to the state health department. And that the Public Health Council is analogous to advisory boards of health to local health agencies all over the state. We provide a voice, we provide guidance, and we provide expertise and the wisdom of our many years of experience to protect the health of our communities. So, as I said, and the document also contains information on the structure of the Public Health Council and the levels of appointment. We currently have 5 appointed members out of an approved board of 10. So we have vacancies that do need to be filled. But we're looking forward to continuing to build on these positive efforts and to help make an impact on improving the health of New Jerseyans.
Madam Chair?
Yes, Mr. Rummett.
To whom is this document going? I think it's well written, but it doesn't say anything that we want. It's not a wish list. It's just a tutorial on who we are, and that's fine.
Yes.
But I think that the main thing is to say what we want, not who we are. And where is it going?
This particular document is for orientation purposes for incoming appointees and administration members to understand the purpose of the Public Health Council. And then the follow-on is our white papers, briefing papers from our committee work.
The reason I ask is because the governor has appointed transition committees as part of her team, and there's only one that has any reference to health at all, and that's dealing with health care, and particularly health care issues with Washington. There are two former commissioners of health on that committee, and also a lady who was the head or one of the heads of the CMS in Washington. But and there's somebody from the Quality Institute in Jersey. But I'm hoping this paper and maybe a support document, like a wish list, would go to those people.
Thank you. I will follow up on that. Okay. Dr. Sahu, did you have any messaging that you wanted to share at this point?
Yeah, I think, we've a few key leaders from New Jersey Department of Health have met with the transition team so far, just to kind of talk about the Department of Health in general. And so we're happy to kind of still funnel or route anything from the Public Health Council, both to the current administration, but also to the new administration to help with transition.
Thank you. All right, let's see. The at this point in time, I don't have any specific feedback on the upcoming budget process, but we hope to be engaged with recommendations and support in the coming weeks, and then another and the last outstanding item of old business for the last item of old business was regarding access to pediatric vaccines, and with the concern being with changing recommendations and confusion amongst parents and providers, that there continue to be publicly available vaccines in order to meet the needs of the youngest New Jerseyans, and when when parents may have difficulty locating vaccines in their community for their young children. And I know there's been some specific statewide efforts on that. Again, Dr. Sahu, did you have anything you wanted to summarize based on that?
Sure. I'll summarize a couple of points. One is that with regards to vaccines for the respiratory virus season, we've used some state money to purchase directly vaccines to then supply to health systems to run clinics both in the north and southern parts of Jersey to help kind of bridge some of the access issues. And then the other thing I'll mention is that at the recent ACIP meeting, they had voted to change some of the requirements around hepatitis B, and so in response, New Jersey Department of Health issued an executive directive continuing to support the birth dose for hepatitis B as well as the childhood schedule for hepatitis B. And DOBI and Medicaid have both followed up in New Jersey with companion documents to support coverage for those things as well. Thanks.
Thank you. All right, let's see. One additional item of old business. There has Mr. Roman. There's been some actions to improve enforcement and inspection of tobacco and vape establishments. Did you want to provide any kind of summary on that?
Give me 2 seconds. I'll get the paper.
Okay.
Hold on.
Okay. All right. New Jersey, again, to improve the health of the communities, has policies in place and pending action on initiatives to reduce youth access to tobacco and vape, and to increase inspection of establishments that sell those products.
Yeah, there's 3 sets of bills that have been put forth by the legislature. A1813 and S3372 prohibit delivery of tobacco and vapor products to individuals under 21. They passed the Senate yesterday, which was Thursday of this week, and now awaits Governor Murphy's signature. There was a submission by a coalition that's working on all this to request a swift signing. That was just put in this morning. Second group, A3992, S4828, increases the penalties for the unlawful sale of tobacco and vapor products to persons under 21. The Assembly bill passed. The Assembly Majority Office issued this press release incorporating language we provided, this coalition. The bill enhancing penalties for selling tobacco and vaping products to youth advances. So that's that one. And the S Bill 4828 is working with Senator Vitale and Senate President Scuturi to post to the January 8th Senate Budget Committee or move directly to the Senate floor. That's the second group. Third group, A2388 S3644 requires more frequent inspections of tobacco and vaping retailers. The Assembly bill is being worked on to secure an agenda spot in January Assembly Appropriations Committee hearing if it's scheduled. And the Senate bill that they're working to get a January 8th Senate Budget Assembly Committee agenda. One of these bills, I think it's that one, calls for increased enforcement, or one of these three bills. And there's a group trying to get an amendment to put money forth for the additional inspections by health departments, because it's like an unfunded mandate if these things pass, and there's no money put forward for the additional inspections. So the group that's advocating all these bills, especially the health department folks and our local boards of health group, are pushing to get money put in there, so it's not just an unfunded mandate. That's it. There's a lady who is Carla Pollack, who is from one of the advocacy groups. She is a licensed lobbyist and advocate, and she is one of the people who's leading the charge for these bills.
Okay, thank you. Okay. Let's see. Are there, if there are no other items of old business, we can move on to new business, which is the notice of adoption of NJAC 8:57, with a presentation by
Stephanie, I'm sorry. Can you give me 1 second? I just want to make sure, because I switched everything over. I just want to make sure that everyone that wants to be in the meeting, I think I got everyone. Let me some in. I just want to make sure.
I will pause for a moment and
is anyone
ready to proceed.
Okay, thank you, Stephanie. Is anyone having trouble now? I think I pretty much let everyone in that was in the lobby. Okay, I think I have everyone now. I just wanted to make sure before you proceed. Okay, go ahead, Stephanie.
Okay, thank you.
Thank you.
All right. Mr. David Sellinger, you are presenting on behalf of the Department of Health?
Yes, I am. Confirming you can hear me?
Yes.
I'll get started then. Good afternoon, everyone. My name is David Sellinger. I'm an executive assistant within the Department of Health's Division of Epidemiology, Environmental, and Occupational Health. I'm here to present the notice of adoption for NJAC 857, and joining me are several subject matter experts. We have Dr. Edward Lifshitz, Kim Cervantes, and Darby McDermott from the Communicable Disease Services Infectious and Zoonotic Disease Program. Dr. Barbara Montana, Jenny Sudakaran, and Jill Denitzsklar from the Communicable Disease Services Vaccine Preventable Disease Program, and Assistant Commissioner Greta Ann Schutz and Monica Bechet from the Division of HIV, STD, and TB Services. During the comment period, the department received approximately 2,686 submissions. This resulted in 463 unique comments from over 811 commenters. These included supportive comments from the Medical Society of New Jersey, the New Jersey Association for Biomedical Research, BioNJ, the New Jersey Healthcare Quality Institute, the Healthcare Institute of New Jersey, the New Jersey Pharmacists Association, and the New Jersey College Health Association, among others. These comments included many questions and clarifications on various topics proposed by the rule, including 12 template letters that were sent in by numerous commenters. A full list of these comments and department responses included within the notice of adoption. 2 amendments were made to the rule text since proposed. Under the communicable disease infection and condition reporting requirements established under 857 2.3b, the text rabies and rabies PEP administration was amended to require reporting of rabies exposures and PEP administration. In the summary of the rule, included with the initial notice of proposal, it was stated that it was intended to read as rabies exposures, but the word exposures was omitted from the rule text. This created a duplicative reporting requirement with the existing requirement to report rabies immediately under proposed 2.3a. As the department commenters noted, the exclusion of the word exposure, the omission will be corrected upon adoption. For the Second Amendment, the department is deleting the requirement for laboratories to submit negative results for influenza and SARS-CoV-2 established under 857.2.6A4. The purpose of requesting these negative reports on proposal was to determine positivity rates. However, the number of results that we received would be exceptionally burdensome on our systems, and we are all now also able to access national positivity data from CDC's Essence platform. We've also made amendments to 3 appendices. Appendix L, our request for medical exemption for mandatory immunization, was amended to reference AAP, ACP, AAFP, and ACOG in addition to ACIP. We removed the table referencing specific ACIP contraindications and replaced with a table for providers to check with each applicable vaccine for which a medical exemption is being requested and the length of time for that contraindication or precaution. Appendix Q, our annual college immunization status report, was amended in response to a comment to specify that the 2-dose men ACWY field is only required if the information is available. Additionally, the meningococcal B vaccine was removed under Section C and included an additional recommended vaccine under Section E. Appendix X, our meningococcal disease informational brochure, was updated with technical amendments to modernize, to improve readability, and to include reference to the rules as proposed. This concludes my presentation. We look forward to any questions. Thank you.
Thank you, Mr. Sillinger. I will open first for questions and comments from council members.